Hi, I'm Dan Parecka. I'm the Executive Director for HealthyLink. We are very excited to be the lead applicant for the Beacon project, and that Beacon project is actually a collaboration here in Western New York that includes the P2 Collaborative, Catholic Medical Partners, the University of Buffalo, and over 40 other partners. And now you're going to hear firsthand from patients and providers that have been participants in the Beacon project about how different aspects has led to improved quality of care.
At Priority Healthcare Facility, we are very honored to be the first long-term care facility to participate with HealthyLink, and we've found it to be a very beneficial relationship, and we're glad that we're part of their network. Long-term care residents are really at a positive position, having the healthcare providers be able to have access to their electronic medical records. I think it eases transmission of information to providers, as well as allowing us access to critical elements to their medical records. The technology has really assisted in transition of care to the community physicians that are the primary care providers for short-term rehab patients. HealthyLink has enabled us to notify the physician at the time of discharge. Therefore, the physician knows when the patient has been here for rehab and is notified that they are home, and will be following up with them.
The Western New York Beacon Med History Project, it's focused on diabetes patients, really has been about developing the framework electronically for us to be able to capture the complete history, or as a complete history as we can, of medications that a patient may be taking or may not be taking, to really get a good picture of what's going on with the patient. As the pilot gets underway, I think some of the benefits that I'm seeing at this early stage are really that we haven't had this place to go yet where we can get all of this data from one source, and that's really what this framework build with the Beacon project is providing. We are getting a lot of good clinical information from one source, and whether it's all complete or not doesn't matter, because we can accumulate this data and look at it as a whole and really make some good informed decisions about what we need to look at or what might need to be changed. So the Med History project has really helped us to better perform medication therapy management. It really allows us to judge the appropriateness, the effectiveness, the safety, as well as the adherence of the medications that the patients are using, and really gives us the opportunity to make sure the patient and the physician are getting the most out of the medication regimen that the patient has been prescribed.
We have an individual who we've been seeing for a number of years, and he has diabetes along with coronary artery disease, high blood pressure, high cholesterol, and also emphysema. And his sugars have been slowly getting worse, so we recently instituted insulin therapy on him. Patient lives part of the year here and part of the year in South Carolina, and so it's been hard to try to have him send his glucose logs. So he was one of our first patients that we decided to approach for the patient portal. And so before the portal, he would write down his sugars, he'd go to a local office max and then send out and fax his logs, which would take a few days for us to get it and then to respond, where now him or his wife sends us his updated logs on a weekly or every 2-week basis, and then we adjust his insulin. And over the last several weeks and months, his glucose has gone down 1.5 points on his diabetic markers. I think that the patient portal is a great tool that we can add to our diabetes care coordination. We're constantly looking at our patients who have diabetes and seeing how can we improve their numbers, and a nice way to reach patients in a different media form is through the patient portal with emails. I think it can improve kind of the one-on-one connection that we have, where they can ask questions and we can send them information like handouts, we can send them links to websites that we think that are good tools for the patient, so then they can kind of do their own homework and then send us back some feedback.
My first appointment with the dietitian and the pharmacist basically we just got to know each other. They wanted to know what I was currently doing to manage my diabetes, and they gave me a short synopsis of what they were going to do for me. They wanted me to start keeping a food diary, number one, which I had never done prior to that, and then to come in at least, I think it was once a week in the beginning, and now it's every 2 weeks, and just literally they, look through my diary, ask me questions if I've had any problems. They've even helped me readjust the controls on my insulin pump now, because it was affecting, I was having highs and lows, and I didn't realize that my insulin pump needed to be adjusted, because I did it originally in my endocrinologist's office. I am thrilled, absolutely thrilled, because it's been a challenge for 29 years, and now I'm finally where I should be, the healthiest I've ever been, and now I have the incentive to stick at what I should do day in and day out, because it can get very burdensome at times.
We started to participate because we wanted to see what the outlook was with the diabetes management. We perceived that we were doing a pretty good job with diabetic management, but we also haven't had the opportunity to benchmark against others. We've typically benchmarked against our own data. So this was going to give us an opportunity to see where we stood in comparison to others. So I think the most significant piece that we came onto as we were going through the process was the ability to implement and utilize our health maintenance features on our EMR. It's been a work in progress with the EMR, and we had not fully enabled all the features. We realized early on in the registry that we weren't demonstrating our flu shot compliance and pneumonia shot compliance with our patient population. So we actually put together a comprehensive team from the hospital side and the practice side to make sure that we were accurately capturing those flu shots at every point of entry into our system, including those that show up in the practice having received that immunization somewhere else. So that's been kind of a neat foray into the registry and into EMR to understand and value that piece of the tracking mechanism that the electronic registry gives you. The only other thing I think is interesting is that often our providers have been a challenge because they love their paper records and they're so comfortable with them. So moving to electronic has been, as it is for everybody, change is difficult. But the patient safety features in there, I think, are probably some of the most powerful things that an EMR and ultimately PCMH bring to you as we move forward. And that is, for example, the allergy interactions, the drug interactions. In the past, when you'd write a prescription, you somewhat relied on the team to catch anything that might be contraindicated. And now there's so many great features that pop up right away that allow you to have a better look at every medication that patient's on from every point of entry into the system. And as a hospital-based practice, that's a pretty significant accomplishment for a community.
Hello, my name is Ken Wilson. I was asked to come here today and talk about the telemonitoring program and the benefit that it has for me and my family. I've been diabetic for a number of years now, about 10 to 15 years ago I was first diagnosed. I've had some difficulties over the years with the diabetes, keeping it under control. My A1C had traditionally run in the 8 to 9 range or higher at times. So the diabetes wasn't under very good control. I had a lot of complications from it. I used to get a lot of edema and swelling in the legs from circulatory issues and open sores and wounds that had a hard time healing. So there was a whole lot of issues involved with the diabetes. My wife is also diabetic as well, amongst various other conditions that she has. And it was really a godsend for me and my wife, but the benefits were tremendous. That call every day, you have to log in every day, you have to do the testing every day, you have to keep on track with what you're supposed to do, because if you don't, you're going to get that friendly call from somebody down at the VNA and say, hey, I heard you had some kind of issue today, you got this going on or you got that going on, what's the story, what can we do to help you? And they would offer advice and tips. They said there's tons of literature on how to manage blood pressure, how to count carbs, how to do all the stuff that you needed to do to keep the diabetes under control. And they also worked with our provider, Elmwood Health, to help us get the medications we needed, the testing supplies we needed on a regular basis. And all in all, the program has been really great for us. Since I've been in the program this year, my blood pressure is under better control than it's been in many years. I think today it was something like 122/77. It used to be way up there where, it was really bad. The sugar itself today was 109 when I woke up with my fasting blood sugar. It used to be 180, 200, 220, 240, anywhere in that range when I wake up in the morning, which, needless to say, was causing a lot of complications that I was getting with leg ulcers and things of that nature. Since I've been in the program, we've got my A1C down to, I think, 6.8 at my last checkup. We've got my blood pressure down to the lowest it's been in many years. My weight, you can tell I'm still a big guy, but considering where I was at the beginning of the year, I've lost about close to 20 pounds since the beginning of the year through participating in this program. And a lot of it has to do with, you have to get up every day, you have to weigh yourself so you know what you're doing from day to day. You know if you're doing good, you know if you're doing bad. You have to check that sugar every day. You have to check that blood pressure so you know right away when something's not right. You know when you're doing good, you know when you're doing bad. And knowing you're going to get that phone call if you're not doing well is a really great incentive. And knowing that there's people at the other end of the telehealth program that you can reach out to if you're having a problem, if you're having a need. I can't begin to tell you how great that feeling is to know that there's somebody out there, somebody that cares, somebody that wants to make a difference, somebody that wants to help us deal with these issues.
You've just heard from actual patients and providers who've participated in the Beacon Community Project about how the quality of care and the ability to deliver better quality care is happening here in Western New York. We're also very confident that this will also lead to lower cost of care here in Western New York and throughout the country.